it's a tube, distinct, but it's lined with material. So blood will flow only inside that tube and cover that area, and hopefully, whether your aorta, your blood vessel will do it, will remodel, which means that false lumen will start shrinking, and that true lumen, where the blood should be flowing, will start expanding where the stent graft is. Okay. It's gonna be not an easy repair in terms. It's easy to put that stent graft in, but we need to do some other things in that false lumen. I'm gonna have to put some coils and some devices there that will help it clot as well. Okay, and I might have to stent one of your iliac arteries too, based on what the CT scan look. Do your legs hurt when you walk?
No.
Okay. All right.
I was gonna ask you, I didn't know if the other ones would be able to be fixed, but I guess listening to you now, we're not even worrying about
No.
lower. Okay.
No.
Okay.
Yeah, it's and I know you had some questions and you called the clinic. Fixing this is not without risks. That's why we do not fix it until it needs to be fixed.
Okay.
Okay? So I would say the biggest risk from this procedure, there's a risk of stroke. It's about 3 to 4%. Okay? Most of the time, even if a stroke happens, it's usually a very small stroke that you will not even feel. Okay? But the risk of a stroke is about 3 to 4%. There's a risk that of spinal cord ischemia, because the spinal cord get its blood flow from multiple blood vessels. Most of them come directly from the aorta in the chest, and all this we're gonna cover it with that stent graft, so the blood flow to the spinal cord is lost there. But there's blood flow from your groins, there's blood flow from the gut vessels, there's blood flow from this arm vessel that will, supply the spinal cord. I would say the spinal cord risk in this case is 1 to 2%. Okay. Again, most of the time, even if it happens when spinal cord ischemia, you get paralysis. Most of the time, it's mild and people recover. Okay. But this is something that I have to tell you and you have to be aware of. So what I will do, most people will put a spinal drain in your back. So we might have to put a spinal drain in your back the day just before the procedure, and we'll take it out in a day or two. Okay. The other risks would be, where we access the blood vessels and things like that, or if we make a cut down, a groin infection, and the likelihood that you're gonna need something in the future is there. Okay, something like a small procedure or another procedure like this one for the lower part, it's there. Because unfortunately this disease does not go away. All right, but you are at a good center here. We do the most dissections, we are one of the busiest centers to do dissections in the whole country. And I already showed your images to my boss, Dr. Arthur. He's the chief of my division, and we looked at them and he agrees with the plan, and he'll be around too, the day of the procedure. And I'm thinking either Friday or Tuesday, but Friday I might not have a room in the operating room to be able to do it, but as long as you're here and we're controlling your blood pressure and your heart rate, you should be okay. But I'm not letting you go home until we fix it. Okay? Any questions? Did they resume all of your medications here? You're taking them?
I don't think I've got it back to all of them.
Okay. All right, I'll make sure that you have your meds and everything, okay?
Okay.
All right. Any questions, anyone?
I do. I'm the
Yes.
sister.
Okay.
Right? So we don't have to open his chest back up.
No,
Okay.
no, we're not opening the chest. Everything has
Okay.
been done by wires and catheters.
Okay.
Who opened your chest before?
The first surgeon I'm not aware of, but it was Medrock.
Madrov? Okay. If you want, I can have him be with me in the procedure as well. Do you have a good relationship with him, or?
Yes, he was there since day one.
Okay. So I'll tell him. He'll know that we're fixing you. He will be there too.
Okay.
Okay? All right, very good. I like him. He's part of our aortic team.
Yeah.
So we do all those cases together as a team.
Okay.
Okay? Most likely I'm gonna book you on Tuesday. Let me see what he thinks, if he has time on Tuesday too and all that stuff.
Okay.
Okay?
All right.
Any questions? Even if you remember some questions, remember we're not fixing you today. So I'm here. I'm not here tomorrow. It's the 4th, but I'll be back here on Friday. You know, and then the weekend, one of my partners will be around in here, but we have fellows, we have nurse practitioners, they're here 24/7, so there's always someone here, okay? All right,
Alrighty.
very good,
Okay.
all right,
Yeah, y'all saved them before. We good. We trust this
All right.
hospital.
very good, very good. Hang in there, bud.
Yes, sir.
Thank you.
You're welcome.
I was about to record too.